Module 5, Respiratory System. And this first set of slides will look at basic anatomy of the upper respiratory system and the muscles of mastication. So, for basic anatomy, this slide is showing basically, this is out of your textbook, 3 divisions of the pharynx, which is the common pathway for air, food, and water. So the idea is basically divided into 3 sections, and the nasopharynx, and then the oropharynx, and the laryngopharynx. Not to make a great deal about that, but that's how the pharynx is divided up. Basically above the epiglottis, above the division of the trachea and the esophagus. That's the upper respiratory system. In this picture, there's not a lot, it's a little bit fuzzy. I believe this is also out of your textbook, but a couple of things to point out are the nasal conchae again, from A and P. You got an inferior, middle, and superior. And another thing that you might note on this slide is the cricoid cartilage. We'll take a look at that a little bit later. And note that the trachea is anterior to the esophagus, which is posterior. The next slide takes a look at some of the cartilages and structures of the larynx. So the epiglottis, all you're seeing is just the tip of it. This is an anterior view. Most of it is posterior. There's the hyoid bone that you remember from A&P1. And then the thyroid cartilage, the largest of the laryngeal cartilages. And the cricoid cartilage, which is unique, and then it's the only one that forms a solid ring. And this view, again, apologize for being a little fuzzy, it's the larynx with a mid-sagittal cut. So you're looking in at the left side, anterior and posterior for orientation. At any rate, this is the cricoid cartilage, and it goes all the way around. And so you're looking sort of in the lumen of the trachea and of the larynx. The arytenoid cartilages, I'm not spending time on those since it's we're cutting that out this quarter. But those are the 3 that I want you to know the orientation of. The hyoid bone, the thyroid cartilage, and the cricoid cartilage. This slide is taken with a scope going down the trachea, and at level A, you are looking at this. You're just staring straight down the trachea at about that level, looking inferiorly, and then as we get a little bit lower, you can see the carina. And the carina is this sort of ridge. It sticks up. Literally, it comes from the name of a boat keel, a spine of a boat that's sitting in the water. At any rate, it pokes up like a little ridge. And food, or not food, but air goes down and splits at this point. It bifurcates into the right and left primary bronchus. So this would be the right primary bronchus. Turns out it's a little more vertical. Where the left primary bronchus goes off at a little bit of an angle. And so if somebody swallows something, inhales, and they get a blockage, a child with a M&M or something, they aspirate it, it goes down the windpipe, it oftentimes will lodge in the right side, sort of drops down into that side of the bronchioles. This slide is just showing the epithelium of the upper respiratory system in the trachea. And what's noteworthy on this, I'd like you to be familiar with this idea of a mucus escalator. Like an escalator in the mall. And this is the mucus with dust and pollen and who knows what stuck in it. And the epithelial cells are ciliated, and the cilia beat in unison, and they sweep and they move this mucus along and moves it up out of the lower airways up to the epiglottis, where you either spit it out or swallow it. And that occurs all the time, and it flushes the debris that's inhaled that gets stuck in the mucus. So it's a way of clearing the lungs. This mucus escalator works fine until it gets paralyzed. And it can be paralyzed by cigarette smoke. And then the cilia become paralyzed, they become disorganized, they don't move the mucus out, and then you wind up having to get it out of your lungs by the old smoker's hack. You have to forcibly cough it out of the lungs. The goblet cells, lots of them are secreting the mucus. It goes out onto the luminal surface. This slide shows, it's taken out of another book, but there are 4 slides, I believe, in this slide set that have this anatomy summary heading to them. So I think there's 6 or 8, A, B, C, D, E, etc. And I would like you to know all of it. So everything on these slides is appropriate for this class, for you to know. So we'll walk through these one at a time. On the left is what we were pretty much just looking at. Basic structures of the upper respiratory system, that which is above the larynx, and then the lower respiratory system. We talked about the larynx. You should recognize the tongue, the nasal cavity, of course. We just talked about the pharynx. The vocal cords are not shown in this illustration. And then we have the esophagus and the trachea. And the epiglottis, of course, is the flap. It seals off the trachea when you swallow. Left lung, left bronchus, right bronchus. We've talked about those. And the diaphragm. We'll spend more time on that. So that's the figure A. B is looking at the muscles of respiration. So these should be familiar to you from A and P1, but we have the sternocleidomastoids, right and left, and we also have the scalene muscles. You remember that the scalene muscles originate on the cervical vertebrae and they insert on the upper ribs. The sternocleidomastoid inserts on the clavicle and the sternum, and these will lift and raise the rib cage during forced inhalation. And then we have the external intercostals and the diaphragm. And those muscles on the left side of this figure are the muscles of inspiration. So the muscles of inspiration are the sternocleidomastoids, the scalenes, external intercostals, and the diaphragm. And the muscles of expiration are shown on the right side of this illustration. And all they include are the abdominal muscles and the internal intercostals, the muscles between the ribs. And the basic idea is that the abdominal muscles compress the contents of the abdomen, which pushes the diaphragm up and forces air out of the lungs. There's not a lot to that. We're just about done. I've broken this module up into several smaller pieces. But let's do the last slide here, which is a chance for you to review the muscles of respiration. So I'll get this set up, and then I'm going to encourage you to pause video and then fill these in. So let's do expiration. And inspiration. So to check and make sure that you know this, you should be able to do this cold. So without looking at your notes, but we're going through this together right now. So go ahead and stop the video, fill that in, and then come back and we'll continue. I'll write it and we'll check. You can check what you did and we'll wrap up this unit. So pause the video, fill in the table at the muscles, and then come back in just a moment. Okay, let's go ahead and fill this in. Muscles of inspiration that we just talked about. The main one is the diaphragm. And the sternocleidomastoid, which, if you're okay with the abbreviation, it's a lot quicker, but we'll spell it out. Sternocleidomastoid, and we had the scalenes, and we had the external intercostals. And all of these lift the rib cage. Lift and expand the rib cage. For inspiration. And the expiratory muscles were the internal intercostals, and the abdominals. And again, the abdominal muscles compress the intestines and the organs in the abdominal cavity. So compresses contents of the abdominal cavity. Which pushes up on the diaphragm. And that forces the air out. Something to note is that inspiration is very active. It takes energy. And that can be significant, particularly for a young child or an infant. If they are having respiratory distress, they are having to spend a tremendous amount of their energy just to breathe. And the idea with little bodies, children and infants, is that they don't have a lot of reserve. And so they'll spend a significant portion of their energy trying to breathe, and when they run out of energy, then they run out of breathing power, and then they're in real trouble. So respiratory issues with infants and children are more serious than with adults who are stronger and bigger. The expiratory process is passive. Basically, all you have to do is let everything collapse. Let the rib cage fall back down, and it just presses the air out. So it's passive, little energy required. There's another slide later on that we'll take a look at that illustrates that again. Okay, so that was short, and the next set of slides will look at the basic anatomy of the lower respiratory system. So, see you soon.